Hello, today we'll be talking about sexual function following spinal cord injury. Please take a moment to pause and read this disclaimer. The key takeaways from this video are to understand the impacts of spinal cord injury on sexual response, understand the different types of erections, and know that you're still fertile if you are interested in having children, and ease your fears and open your mind to the possibilities of participating in sexual function again. Sexual health is part of your health. We want you to know that this is part of your ongoing health, your ongoing quality of life. And so if this is something of interest to you, please feel comfortable reaching out to your healthcare providers to ask more questions if down the road this is something that isn't going well and you would like to know additional resources. For some people, this is not on their mind right away, right after injury. For some people, it is one of the top things on their mind. So it really varies, but just know that it's part of your health. The sexual response is when the brain and the spinal cord are communicating smoothly to make the body run as it did prior to injury. That being said, when there's an interruption to that communication through spinal cord injury, we have an interruption as well to sexual response. To make sure we're all on the same page, we'll go over the sexual organs. The penis is what is filling with blood that creates the erection. The urethra, which is the pathway for ejaculation, as well as the exit point for urine. The scrotum is where the sperm are housed and produced. The prostate also produces the semen. And the impacts of spinal cord injury on sexual response, your anatomy has not changed. The nerve's ability to respond to sexual intercourse, pleasure may have changed, but your physical anatomy is still, the structures are still the same. Everyone's impact, their sexual response is going to be unique to their injury, and what you will now find stimulating sexually will be unique to yourself and your recovery, and it can change over time. So the changes right now might be different than in a month, than in 6 months, and then even day to day, depending on pain and depending how you're doing. Certain things might work better or not work as well, depending on those factors. When we talk about nerves and the nerve response and eliciting things like an orgasm, when some nerves aren't doing what they're supposed to do, we have to increase the amount of nerves that are working together to fully achieve the goal, so that the goal is either partially achieved or fully achieved with a lot of teamwork. Noting that there is sexual neuroplasticity over time. So how you are today does not mean that that's how you're going to be down the road. Some nerves can't do what they used to, but that doesn't mean that everything stops functioning. The focus may not be as much on the genitalia as maybe it had been prior, but we'll talk about different tips and tricks for eliciting a pleasurable experience. When it comes to erections, we have 3 main pathways. The psychogenic pathway, which you can see here, comes from the T11 to L2 portion of your spinal cord. The reflexogenic pathway comes from the sacral nerves, 2, 3, and 4, and then a spontaneous erection. We'll go into each of these. The psychogenic erection typically works best for people who have an injury level at the T12 level or below. And with this, you can use a lot of different sensations to help elicit the psychogenic erection. So really thinking about setting the mood with lighting, with sound, using visual fantasy play, all of that can really help with eliciting a psychogenic erection. I mentioned the music, the lighting, different types of touch. In the areas where your skin and sensation is intact, you can utilize lots of different textures and touch to help elicit the erection. Reflexogenic erections typically work best for people at the T11 injury level or above. Anyone in the cervical spine or anywhere through T1 through T11. Generally, reflexogenic erection is going to be the easier pathway to elicit an erection. And with this, you would have a lot of physical touch to the penis and the surrounding area, and that is controlled by a reflex. So things like stroking, vibration, caressing, sucking. Sometimes people will use sex toys to help with that vibration. And so all of that can incorporate, even if you're like, wait, I don't feel anything down there, your body can still have a reflex. And so it can still have an erection. A spontaneous erection, you may or may not have experienced this while in the hospital. But typically this comes from when your bladder is overly full or when a Foley catheter maybe has a kink in it. And so this is generally not the type of erection that you would be able to utilize to fulfill achieving orgasm. You might notice that it's there, but it's not going to elicit the sexual response. I mentioned orgasm. So an orgasm is a very complex event where the nerves, the penis, and the brain are all coordinating together. Most people report that they are able to achieve an orgasm. It may not feel exactly the same as before, and it may require a little bit of additional time. So the length of time the orgasm is achieved for and exactly how it feels may or may not feel the same. In some cases, there can be the feeling of ejaculation without semen coming out. And so if that was the case, the big things to note would just be if you are trying to reproduce, obviously that would become an issue. In rare circumstances where the semen goes back into the bladder, if you notice that you catheterize afterwards and there is semen in there, not to worry. That's just part of that sexual response. That's called a retrograde ejaculation and does not happen frequently. If you're doing all the different recommendations and just not eliciting an erection that you are satisfied with, then discussing with your doctor about what are alternative options, such as oral medications or a penile injection, which directly delivers the medication to the penis. An oral medication would be something similar to Viagra. When we talk about fertility, if you're interested, having children is still possible. Most of the time, the issue is really related just to the speed of the swimmers, if you will, of the sperm might be a little bit slower. If you are having that dry orgasm where the ejaculation isn't coming out, you definitely want to work with our fertility specialists and get a referral from your doctor so that they can help with facilitating that. For tips and tricks, these are from other individuals with spinal cord injury as well as research, but really thinking about like you're having sex for the first time. And with this, we mean have a sense of humor about it. It's not going to be perfect the first time. It's going to get better with practice, and really knowing that good communication is so important for feeling comfortable and knowing that, it's the first time. We're not exactly sure how it's going to work, and it doesn't hurt to maybe have like a chuck on the bed if you're in the bed or on the chair, so that in case there is anything else that happens, such as an incontinence episode, that it would be easier to clean up. Really experimenting with all of your senses. I know when I talked about the psychogenic erection, it was very focused on using multiple sensory pathways, but even with a reflexogenic pathway, it does not hurt to incorporate as many senses as we can to really help elicit that sexual response. And so the focus does not have to be primarily on the penis. However, that is part of the sexual response, and so we want it involved as well. And then pleasure zone or erogenous zone mapping is something that you can do depending on your mobility by yourself or with a partner, and that's where you're really searching for areas of intact sensation that might be heightened to touch or to caress or to kiss or different textures. Some people report, like their shoulder becomes really sensitive, or their hair or their scalp or their ear. And so finding that area that becomes really sensitive for you. Some people say that at their level of injury on their spine can be really hypersensitive. So that's something to explore. And then knowing once again that things can change over time and that things that maybe weren't sensitive before can become more sensitive. So really good communication and an open mind goes a long way when thinking about returning to sexual function. For additional resources, we highly recommend that you look at our Nielsen Rehab Community Resource Library under the Parenting and Sex section. Please take a moment to scan this QR code so that you have access to this. And if interested, we also have peer health coaches. Our social worker can help set you up with one if you want to actually talk and discuss some of these questions that you have from somebody who has been in a similar situation. That's a really great place to start and utilize that resource. So the less fun thing to talk about is the precautions. We do want to keep your safety in mind. So being aware of your skin, what position you've been in, for how long you've been in that position, avoiding shearing, making sure you're changing positions, and then maintaining spinal precautions initially. So a position like a side-by-side or a cuddle position probably is going to be easier initially. And always emptying bowel and bladder just as you would previously. Nobody wants to participate in intimacy when they need to go to the bathroom. So having emptied your bowel and your bladder will help minimize the risk of having incontinence during the orgasm. And then you do need to protect against sexually transmitted diseases as well as unwanted pregnancy. For injuries at the T6 level and above, be aware that an orgasm can elicit an AD episode, or if you're in a painful position for your body, but maybe can't tell that it's been painful. If you start to have symptoms of AD, definitely stop and check your blood pressure to make sure that your safety is number one. And if AD is being caused by orgasm, once the orgasm passes, your blood pressure should also return back to normal. But if it's being caused by pain, then that would be another reason to stop and really check what's going on. The take-home message is that many people report they have fear around participating in sexual function, but that decreases over time as you become more comfortable with your body and more aware of your own sexuality. Self-pleasure and pleasure with a partner is still possible. There are a lot of amazing smart apps in conjunction with sex toys and mounts, so working with an occupational therapist to help problem solve some of these things for more independence with self-pleasure or pleasure with a partner can be really helpful. And good communication with your partner, if applicable, is key. And I will recommend, again, that you take a moment to go to the Community Resource Library and look at some of the videos that are listed under that sex and parenting section, as there are some really great ones for understanding positioning and kind of getting a better idea of what it could look like and how you could participate and what maybe wedges or pillows might be needed to help with participating in sexual function. If you have questions, please bring them to your rehab educators or your healthcare team. Thank you so much for watching, and feel free to reach out for additional resources. Thank you. Have a nice day.